Many people at home are checking their medicine cabinets after warnings about Benedryl and other allergy medications. For many of us, it's a household staple. So is there really a need for concern? Well, here to answer that is allergist and immunology specialist and professor at Queen's University, Dr. Ellis. Doctor, thank you for joining us this morning. Let's jump right in. Benedryl has been around for decades. So why are there warnings now?
So it's important to realize that these aren't new concerns. Allergists have been expressing our concerns about the side effects of these older sedating antihistamines for many, many years. But we recently released a position statement to try to draw our concerns to a higher level of awareness amongst public and providers and pharmacists.
What are some of the risks of this type of medication, doctor?
So they have a number of side effects, which are the real concerns. I mean, they do work as antihistamines, but the problem is that they cross onto a lot of other receptors. They can bind to cholinergic receptors, which cause drowsiness, sedation, can cause dry mouth. You can have side effects with urinary retention, weight gain, impairment of cognition, learning, memory. So there's a lot of reasons to avoid these older sedating antihistamines, particularly when we have so many of the newer second-generation agents that are very safe and effective.
All right, let's look at the other side of the coin. Benadryl's maker, Johnson & Johnson, they said in a statement that, quote, Benadryl products have been trusted by doctors and moms for more than 60 years to provide effective symptom relief from allergies and allergic reactions. The company said the products are approved by Health Canada and, quote, when used as directed, are safe and effective. If there are concerns about these side effects, why aren't these products behind the counter?
Well, that's what we're hoping that perhaps Health Canada will reconsider. We're not saying to make these prescriptions, we're not saying to make them unavailable, but just to make sure that if they are behind the counter, then you're having an opportunity to have a conversation with your pharmacist to make sure that it actually is safe for you.
And just as a matter of sort of a good rule going forward, if you've been using a product like Benadryl successfully for years, would you say there's any reason to stop if you've been using it properly?
That's a great question. And no, I have lots of patients where I've given them permission to carry on with an older sedating antihistamine because it's not causing them those side effects. But if you're choosing for the first time, or if you have other medical conditions, or if you're particularly children, we know that these medications can impair learning and memory formation. It's really better to choose a safer one if you've never tried anything at all.
All right, doctor. Well, listen, there've been a lot of questions. A lot of people were surprised and a little worried. They didn't know which way to look. So we appreciate that you kind of you gave us the answers that we probably needed this morning. We appreciate it. Thank you so much.
My pleasure.
Thanks for watching. If you like this, be sure to subscribe here.
And you can check out more Your Morning videos right here.